Hello and welcome to Psych 601, Psychology and Law. My name is Michael Griffin and I'll be your instructor this semester. I just wanted to take a moment to introduce myself to you, tell you a little bit about my education, my work history, and then just personally a little bit about who I am. And I find that it's always been nice for me whenever I'm in a class to just know a little bit more about my instructor. And so feel free always to ask if you have any questions about any of these experiences or things, or you just want to know more. I'm guessing as the semester progresses, you're going to learn a whole bunch more about me just based on examples I have and experiences that I'm going to just share with you in passing. So without further ado, let's get started. I'm going to start off by telling you a little bit more about who is Dr. Griffin, who I am professionally. And so we'll start off with my education. I got my undergraduate degree at Loyola College in Maryland, now Loyola University, Maryland. My focus was in psychology, certainly, but I started off as a sociology and criminology major and switched over. And that was kind of the primary area of interest of mine, kind of how I first got into psychology and law. In fact, while I was at Loyola, I started a psychology or a forensic psychology undergraduate course because I just had that much interest in it. I then went on to William & Mary, where I got my master's degree in experimental psychology. So just doing a whole lot of research, learning about research methodology, statistics, that sort of thing, and then took a year off getting experience within psychology and law before I started at the University of Alabama, where I ended up getting a clinical PhD in psychology with a focus on psychology and law. The last year of clinical psychology programs, not just at Alabama, but all around the country, include a clinical internship year. And that's how I came to the great state of North Carolina. I was awarded an internship at UNC with a major rotation at the Federal Correctional Complex in Butner, North Carolina. If you have not been there, it's actually a really cool facility. There are 5 institutions there. There are 2 medium security prisons there. There is a low security correctional institution. There's a prison camp. And then there is a federal medical center, and that's what's pictured there on the bottom left of the screen. And that federal medical center has people, where all security levels, maximum to minimum, and they're receiving medical treatment, like, for example, cancer treatment, that sort of thing. But then there's also a primary psychiatry or psychiatric ward there where people have mental health problems and are getting mental health treatment or are being evaluated for some sort of mental state defense or something along those lines. The rest of my time during internship, I was through the UNC Department of Psychiatry and the hospital system. And then after that year was completed, I officially graduated and then went down to Florida State Hospital in Chattahoochee, Florida, where I was for 1 year. And then I moved back to Alabama to start my work history, which I'll start up kind of talking about on the next page. As for another certification, I am board certified in forensic psychology. I'm not sure how much you know about board certification, but there is the American Board of Professional Psychology, and they award board certification in a whole range of specialties, like, for example, clinical psychology, geriatric psychology. Forensic psychology is one of those specialty areas. It involves a written exam, submitting a work product, and then also doing an oral exam. So that's a little bit about my education. As for my work history, I had mentioned that I went back to Alabama after I finished my postdoc. So when I went back to Alabama, I started a private practice right away. It was called just Griffin Psychological Services at the time. And you can see the logo for my business at the bottom left there is now Griffin Trial Consulting and Psychological Services, just to help people who might want to hire me have a little better sense of what it is I do. In addition, I worked at Taylor Hardin Secure Medical Facility. It's a hospital in Tuscaloosa, Alabama, where they have people who have either been convicted of a crime or charged with a crime who have concerns about significant mental illness. They may get evaluated for court, make sure they're competent to stand trial, or if they've already gone to court, they might be getting treatment because they are found to have be not guilty by reason of insanity. Since 2012, I have been working as a compensation and pension evaluator at the Durham VA. What that means is if somebody has a mental health problem and they are claiming it's because of their military service, they come in for an evaluation with somebody like me. We evaluate, see if they do have a mental health problem, and if they do, whether we think it's kind of linked to military service or otherwise. And if it is, then they can be awarded compensation benefits for that. So you might get some free services, treatment, you might get money, so some financial compensation. So I've been doing that since 2012. And around that same time, I started working as adjunct faculty, teaching a clinical assessment course in the Center for Rehabilitation and Mental Health Counseling. That's over in Allied Health Sciences. And since 2017, I've been teaching the doctoral students here in psychology and neuroscience advanced assessment course. And so that's my work history. Those are my experiences. And most of the examples I'll use throughout class will be kind of brushing on one of those. I've also taught pretty consistently, including way back starting in my graduate program. So I have quite a few classes under my belt and hopefully can use some of that for helping y'all learn a little something this semester. Now, to answer the question of who is Michael, this picture here, I think, gives you just a good quick snapshot of who I am personally. My wife, Desiree Griffin, actually works in the Department of Psychology and Neuroscience here at UNC. She, in fact, you might have all had her at some point, and you might have signed up for this class with the hope of having her again. And so I do apologize for that if that was your hope. Rest assured that I find her to be a wonderful instructor, and she is going to help inform this class for us. She's already helped a little bit with me setting up Sakai because she's very good at that. And then those other four little humans there are our children. We have, starting at the oldest at 9, Andrew, and then Carolyn, and then Matthew, and the youngest there is Danielle, and she is 2.5. So a lot of my free time, personal time, fun time is spent with that group right there. And just to tell you a little bit about what we do like to do when we're together, we all kind of love sports. Desiree and I both went to the University of Alabama, so we love Alabama football. She is actually born and raised in Alabama, so she was kind of born and raised as an Alabama fan. I didn't really have any allegiances before I got there in 2002, and so I just started cheering for them then. We have since adopted Carolina basketball, and we also like Carolina football in the event that they're not playing Alabama. But we try to get to Carolina sporting events like the two pictures up there are basketball, and then we went to a soccer game. We love travel, as you can see in that middle picture. We are in Southern California there, and then over on the right side, we're up in DC. Down at the bottom is a picture from Martha's Vineyard. We had gotten up there and we're taking my daughter to the beach. It's one of her first trips to the beach that she actually kind of remembers. But we just love to get all over the place, see different things. We actually, in the upcoming year, depending on coronavirus things, hopefully we're going to do a cross-country trip. We'll just kind of see how things go and what's appropriate and what we can do. But it's something that it's on our to-do list. If it doesn't work out this year, we're going to try to get it in as soon as we can. One last thing about who I am. I'm very involved in my church, and so this is our life group. These are people that are through our church, and we spend a lot of time with this group. You might guess that this picture also was taken prior to COVID, so I guess there'd be a whole lot of masks and a bunch more distance between us all if we were taking this picture again. But we still do spend a lot of time with these different people. Most of it's virtual now or in very small groups with social distancing. As the weather got cold, we couldn't do anything outside anymore. But we do try to still get up with them. These people are all really important to us. So I might make reference to some people or children or experiences I've had with this group here. So that's me. That's a little bit about who I am. As I said, I'll be talking more about myself as the semester progresses. Please feel free to ask anything you might have. If you have questions about any of these things I talked about or anything else, I'd be happy to answer. I'm an open book. And of course, if you've had classes with Desiree, you might already know some of these things. But I look forward to getting to know each of you. And again, feel free to ask me more about me.